Welcome back. Did you know that March is Endometriosis Awareness Month? Such a painful, complicated disease that about 10% of women are facing right now.
Melissa Cole tells us what the team at UCONN Health is doing to understand, diagnose, and treat it. Take a look.
There were some mornings where I literally just could not get out of bed. I'd be under a heating pad for majority of the morning, not wanting to move at all because it was just sharp stabbing pains.
Was that the main issue?
Yeah, it felt like someone was stabbing me and twisting a knife into my stomach.
Yeah. Did you try and take medicine?
I did. I tried tons of ibuprofen, Tylenol as well, kind of went back and forth with those. Minimal relief.
And you probably missed school?
Yes, a ton of school.
Jerica Leary is describing the pain she felt each month during her menstrual cycle. Desperate for relief, a doctor offered her birth control.
And me and my mother were really not okay with that, I would say, just because we didn't want to put a Band-Aid on the symptoms. We wanted to find what was the root cause of my symptoms, just because I didn't want to be on birth control for the rest of my life. I didn't want to be taking a pill just to be able to go about my day.
How are you doing?
Good. I mean, since the surgery, really good.
She finally got answers when she met with Assistant Professor of Obstetrics and Gynecology, Dr. Danielle Luciano of UCONN Health.
She was having painful periods that were making it such that she couldn't go to school, and she couldn't do her sports, and she couldn't go to social events. And then what kind of nailed it for me was that she was having symptoms very similar to what her mother had had, and that her mother had been diagnosed with endometriosis. As we know, there's a 7-fold increased risk of endometriosis if you have a family member that has endometriosis.
Jerica's diagnosis, stage 2 endometriosis.
So endometriosis is a systemic inflammatory disease that's characterized by tissue like the lining of the uterus growing outside the uterus. So most of the time it grows in the pelvis, so I mean on the ovaries and on the uterus, but it can also grow on the bowel, it can grow on the bladder, and it can grow in farther away places like the lung or near the heart in the pericardium.
Endometriosis affects 1 in 10 females. It causes pelvic pain, bowel and bladder dysfunction, and also infertility.
And then it's associated with a lot of other systemic inflammatory diseases like irritable bowel syndrome, painful bladder syndrome, pelvic floor dysfunction, and migraines.
Oh, wow. Do we have any idea why this happens?
No. We have no idea why this happens. We don't know how this disease starts. There are a lot of theories.
Gynecology surgeon Dr. Alexis Newmark tells us why it's so hard to diagnose.
So endometriosis is actually quite difficult to diagnose, as many patients may have completely normal imaging of ultrasounds or MRIs, which is often how it gets missed by many doctors.
The team here at UCONN Health, along with Jackson Laboratory, started a new program called EndoRise. The goal is to raise awareness about this condition through research, education, and support.
So we know that there is quite a delay in diagnosis, up to 7 to 8 years, or even up to 10 years for some patients. And our goal with reaching out to the community, speaking with the school nurses, reaching out to the colleges, is to really minimize that delay in diagnosis to decrease the long-term effects of endometriosis. And as we saw with Jerica, it can really have a big impact on their lives. So we really want to decrease that delay to get these patients treatment as soon as possible.
Yasmina Julanjic of Jackson Labs is a program manager of EndoRise. There are around 60 participants in the study so far. Collected data from each of these women who all have endometriosis will help doctors better understand it and treat it.
It's really important for us to have a 360 view of endometriosis, so a biological level, but also, like I mentioned, clinical history, current medical history, and hormonal therapies, different pain treatments that the patients are getting, but also quality of life.
Right now, surgery is really the only treatment. Dr. Luciano performed Jerica's in August.
A lot of the areas that she had talked about having pain was where I was seeing these lesions, and so removing those lesions was able to help her with her pain.
After my surgery, I was really minimal with the pain. I would say I'll have some painful periods now, but nothing as far as what it was before.
Wow, so it made a big difference.
Yes, it did. And I have been in school so far. I haven't had really any absences due to the pain of my periods.
I think we don't talk enough about menstrual health, and we don't talk enough about things that are not normal. I mean, it is not normal to have painful periods such that you can't go to school and you can't participate in sports. But if your mom always had painful periods and your grandmother always had painful periods and your aunts and your cousins all have painful periods, then you think that that's normal. And so if we don't raise awareness and we don't start talking about it, we gotta start talking about it, then we're not going to be able to make a difference.
Jerica is doing her part to spread the word.
So I will hear some people, like, they talk about having really painful periods, like even ones where they're throwing up in the morning or like they can't move, like debilitating pain, the same that I had. And I have said to a few friends, like, hey, like, this sounds like what I had. Like, I would go see a gynecologist, maybe get checked for endo, see what's going on.
All right, if you want to learn more about EndoRise, please visit the website. It's ctendorise.org, and it's ENDORISE, endorise.org. You can also visit health.uconn.edu.
Terrific. Great story. Thank you, Melissa.